What do you do if your baby falls on its head? This is a tricky question because it's very dependent on your baby's age. A newborn really doesn't fall, right? A newborn or an infant is usually dropped on their head. So that's a whole different story than falling on your head when you're a toddler and walking. If a newborn or infant is dropped on their head, you need to immediately call your physician. You want to make sure that the baby cries immediately and the baby is responsive to you. If you see or feel a swelling and it's in a newborn, you should call 911. I have had patients that have had minor falls from carriages or somebody dropping them on the floor, and the parents will think, oh, it's not a big deal, and I'll say, listen, you cannot diagnose this. You have to go to the emergency room, and oftentimes this baby has a fracture that would have been undetectable to the parents. The reason it's hard to detect what kind of head injury it is in a child, in an infant, is that the baby's fontanelles are still open. So a baby has a soft spot, that's the fontanelle, and babies have sutures, and these sutures are not fused. That's why babies' head shape changes as they're growing. In a toddler who after 15 months, their skull is already fused, that baby having a head injury will be very different from a baby with an open fontanelle having a head injury. Because with the open fontanelle, they don't get a headache, and they can't really tell you about it because they're infants. They don't get as much of a headache because it's an open space, so it's kind of like a balloon. It can expand, and to the untrained eye, that parent really wouldn't know if baby's fontanelle is bulging or if they're having any bleed in the brain. They don't walk, so you don't see a wobbly gait. They can't tell you I have a headache, and they can't tell you I have double vision. In older kids, like a toddler who starts to walk, they fall all the time. They fall on their head, and their head is much larger in comparison to the rest of their body. The head has a larger surface area, so they topple over. Then you get tons of phone calls as a pediatrician. My baby hit their head, my baby fell in the park. What do you do? So in this case, your baby can say, Mommy, my head hurts, or vomits on you. So one sign of increased intracranial pressure or something going on in the head is vomiting. So if your child vomits 2 or 3 times after a head injury, call 911. You need to go to the hospital. If your child doesn't cry immediately after a head injury, call your doctor. If your child can't wake up and has a loss of consciousness, call 911. If your child seems okay, has a big lump on their head, we recommend to put ice. Try as best you can to hold it on for about 20 minutes because the ice really takes down that inflammation. It's hard to keep ice on a toddler, I know, but do the best. Even 10 minutes on, 10 minutes off, 10 minutes on, 10 minutes off. And when you go home, you can give your child acetaminophen. Acetaminophen, the trade name is often Tylenol, and that's safe because it doesn't interfere with bleeding. When your child has a head injury and you don't really know if something happened inside their brain or inside their skull, do not give ibuprofen because ibuprofen can make you bleed more and it could worsen a head injury. That being said, this is a lot of information for a layperson. So if your child falls and hits their head, the best thing to do is call your doctor and consult with your doctor whether you should come into the office for observation, stay at home, or go straight to the ER. Oftentimes the doctor will say, you know what, it sounds just like a benign fall. I want you to watch your child and wake them up throughout the night. And the parents freak out and say, what do you mean wake my child up throughout the night? How will I know? And you say, wake them gently, look into their eyes, see that they focus on you, that they know that you're the parent. You say, Mommy and Daddy are here. You take a good look at them, they respond to you, they often smile, they roll over, they go back to sleep. If you wake that child and they don't seem responsive, their eyes are rolling backwards, of course that would be a reason to call 911. If your child complains of a headache, complains of double vision, can't walk, is wobbly, those are all reasons to call 911.